We're back now with Dr. Darien, and he's taking a look at some of the questions that you are asking here. Here's one. How do you get a staph infection, and when are they considered serious? This is from Liz S.
An important question. So staph stands for Staphylococcus. This is one of those bacteria that causes those nasty infections. Sometimes in text you'll see it like flesh-eating bacteria. We don't use that in medicine in that term, but we do use terms like MRSA, which means that it's resistant to certain types of antibiotics. So how do you avoid it? The basic things that we all do. Washing your hands, protecting injuries and wounds from outside exposure, because often that's how it happens. You get a scratch or a scrape, and then it gets exposed to dirt, bacteria gets in, and then causes the infection. And then knowing what the red flags are. If you have extending redness, if you have a really tender or swollen area, and it's getting worse by the day, that is when you need antibiotic treatment most likely, and you need to get evaluated.
Your prescription for wellness?
It's about skin. So since we're on the topic of how to treat infections, we can talk about how to treat rashes. This is something that I see often in the emergency room, and I'm giving constant guidance because we all have different ideas about what we think works. So number one, avoid scrubbing the area. You want to make sure that you use gentle cleansers often to make sure that you clean off the area and keep it dry. And then also, if you notice that this redness might have randomly come and not be associated to an infection, you want to stop using any recently added cosmetics or lotions because often it's allergies, whether it be to what you're putting on or medications that you just started. And then also know what to use. For example, for contact reactions, things like poison oak, poison ivy, calamine lotion works. For other types of reactions like eczema, which is an immune process, often oatmeal-based products, so products with menthol can help. And often just with that, just making sure that you're being as simple as possible, avoiding perfumes and avoiding other heavy-duty cosmetics.
And a good bath in oatmeal just never hurts.
It doesn't. I heard that you do it every day.
That's a lot of cleaning.
No. Dr. Darien, thank you very much. Folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions at ABC.
You love how immediately I'm like, who was cleaning your bathtub? Next here.